Okay, so for our question that we just did with our patient who took Nitro for chest pain and is now having this severe headache, and if you're thinking, I don't know the connection between the headache and this medication, I don't know why that would happen, here's a little bit of content for you. So we know that nitroglycerin is going to cause vasodilation of the coronary arteries, and it's going to then resolve the chest pain that this person has. And it'll cause vasodilation of the arteries, which will then increase the blood flow to the heart, right, to the heart muscle. And when we do that, we increase oxygen to the heart, which is going to take away the pain because the pain was caused from a lack of oxygenation. So not only will it cause dilation in the coronary arteries, but it also dilates other arteries, or and other vessels, I should say, really, including the brain. So if I'm just going to draw a vessel here in the brain. So if we have vasodilation, so here's a dilated blood vessel, I'm exaggerating here, in the brain, then we have this expansion of the blood vessel. And with this expansion of the blood vessel comes increased blood flow. And even on the side of the head, you can see things like the blood vessels becoming more prominent and they become more tender. But as we have this expansion, this dilation of the blood vessel, all the nerves that surround it and that are nearby will get stretched too. And so that sends signals to the brain when you're stretching out those nerve fibers, right? That's painful. Pain is happening. And it can cause inflammation as well in the area. And so that's why the patient might experience a really bad headache. And so it's a side effect of the medication's expected effect, expected intention of causing vasodilation. And the more often that the person uses nitroglycerin, then the less severe that headache becomes to be, because they do build a bit of a tolerance to it. So that's why our patients who take nitroglycerin might experience really bad headaches because of what's happening in the brain, because of what's happening with that expansion and stretch of the vessels and the nerves that surround it.